Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? Welcome to episode 126 of the Everything Medicare Podcast. I'm your host, Christian Brindle. Every single week, I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. If you don't know who I am, folks, or you're not familiar with my work, I've published 2 books. I'm a published author on the topic of Medicare, written 2 books on the topic of Medicare, including the most popular book I've written, Medicare Guidance, Picking the Plan for You. We've been doing this podcast for about a year and a half now, basically providing all different kinds of useful information that you really can't find in most other places on the topic of Medicare. This podcast has really turned into a library of content, folks. A library of content of different topics and different things that you can potentially go back, reference later if you run into this issue, or maybe you have a friend that runs into a particular issue. Today is all about Minnesota Medicare supplement plans. So I have a story to tell you. I've known of that Medicare supplement plans were different, very different than the rest of the country, but it's not just Minnesota. It's also Massachusetts and Wisconsin. Minnesota, Massachusetts, and Wisconsin all kind of have this same difference as far as how the plans work. Not to say that the plans are the same in all those different places. Point blank, folks, this is how this works. In most states, in the Floridas of the world, in the Californias of the world, in my home state in Utah, Texas, in most states, the plans that we've discussed up until this point are what's available in the Medicare supplement world. The Plan Fs of the world, if you were eligible for Medicare before 2020. We've talked about that in nauseating detail. The Plan Gs of the world, the Plan Ns of the world, the Plan Ms of the world, the Ks, the Ls, things like that. These plans are very simply put, designed by Medicare. Medicare determines what they can and cannot have in their coverage. And then the insurance companies pick them up and they offer them at a certain price. But the plan benefits are the same from state to state, from market to market. But not in a place like Minnesota. This is really fascinating to me. Years ago, when I was first getting started in my career, I had a couple who were clients of mine and worked with me, and they were fantastic people. I really liked them quite a bit. We worked together for a number of years. They were 2 of my very first clients and customers when I was getting started in the industry. And they ended up moving to Minnesota. Now, at that point, I was not ready to begin offering plans in different states. I was still a young, new broker in the business. And so I didn't attempt to pick up a license in Minnesota. I was sad to see them go. They were 2 of my favorite people. Still talk to them from time to time. But they went to Minnesota. I was not able to offer them any coverage at that point. But I did kind of go out of my way, because I liked them so much, to try to research the market and kind of give them my opinion on what would be good out there for them. And, you know, they had Medicare Advantage plans out here, but they were at the point where they wanted to transition into Medicare Supplement Medigap plans. So that's what we were looking at for them in Minnesota, just to kind of give them an idea on kind of what they might be able to look for, even though we didn't benefit from it at all. And what I found out was Minnesota plans do not play by the same rules as the rest of the country. It's not just Minnesota. Like I said, it's also Massachusetts and Wisconsin. They have weird plans, to point blankly. And I'm fascinated by this too. I'm fascinated by it. In segment 2, I'm going to go over exactly what plans they have available and kind of how they work to the best of my understanding. Of course, I'm not licensed in any of these places, so it's based on my own personal research. I've never done a plan in one of these places. if there's an agent or broker or somebody that does business in Minnesota or Massachusetts or in Wisconsin that kind of deals with some of these different plans, although I'm more interested in the Minnesota side of things, and you would like to come on and have me interview you and talk to me about these plans and share more details about what I'm going to go into with the audience, shoot me an email. ChristianB@xmission.com. Christian, Christian, B as in boy, at XMISSION.com. ChristianB@xmission.com. Shoot me an email. Let's talk. I'd be interested in having you on if you're one of those brokers. Because this is not an area of expertise to me, because I'm not in those areas, right? I'm not licensed in those markets. But I've done a tremendous amount of research, talked to some people that I trust, and I think it's fascinating. I'm fascinated by it because typically Medicare supplement plans are supposed to be standardized, right? They're going to be standardized, meaning that, the different Medicare supplement companies can offer these different plans, and it's going to be the same coverage in all markets, all states, but this is an exception to that. They don't have a Plan F, a Plan G, a Plan N in Minnesota. They don't! It's bizarre. This is crazy. And anybody that's listening in Minnesota, this episode is for you, but also, it's a similar kind of structure to things for Massachusetts and Wisconsin as well. Okay. But anyway, these folks, these clients of mine, they were transitioning to moving to Minnesota, and tried to do my little bit of research, and what I noticed was, what in the heck? What in the heck? There is no Plan G's there. There's no Plan F's there. There's no Plan N's there. What is this? What is this? And it's strange because it's based on the state. So all the insurance companies in that particular state, they all offer the same plan. So they are still standardized, but they're plans that are specifically for people that live in Minnesota that you can't get elsewhere, that work quite a bit differently as far as their benefits than the Medicare supplement plans do in every other market. This is fascinating to me, folks. Like I said, if you're a broker listening to this and you live in Minnesota and you're a Medicare expert in Minnesota, you contact me and come get your butt on this show with me. Reach out to me. I'll have you on. You can talk about your company. You can promote your company. I'll make it worth your while, but I want to get some value to the audience on this because this is fascinating. Because throughout our Medicare journeys for most of us, we're all taught that Medicare supplement plans are supposed to be standardized from state to state to state. All the states have the same plans. The premiums are different. The insurance companies that offer them might be different, but the plans themselves are the same. This is an outlier to that rule. This is. And I'm really, really excited to talk about it. I've been wanting to do an episode about this for probably over a year, but it just didn't have the priority at the time. There were episodes we had to do episodes on first. But we finally got around to it. I'm really, really excited about it. Let's take a break. Let's hear from our sponsors for this week. And then in segment 2, I'll be back and we'll talk exactly on how these plans work and how they're different in Minnesota. Don't go anywhere. I'll be right back.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
You know, folks, I had thought about trying to kind of expand this show to where, we kind of had a co-host on here with me. And the idea is very interesting to me, trying to have somebody that, I have a lot of chemistry with, that I could kind of bounce ideas back and forth with. We could kind of have a conversation. But I've never been entirely positive or confident that I would play nice with others on this platform, to be honest with you. I'm a little reluctant for that reason because I know myself. I know that I don't always play nice with others when it comes to, working together and kind of doing things. Play nice with clients, love clients. But when it comes to the outlook of the show and this podcast on kind of what it's going to look like, I've always been a little reluctant to that, to kind of give up some control. But that's something that I'm always interested in. I wanted to bring this up because if you think that would be an interesting dynamic to have a co-host on this show, please let me know. Shoot me an email. I gave you my email in the segment 1. ChristianB@xmission.com. Shoot me an email, let me know. I'd love to hear some feedback from you on if you do get tired of just hearing me babble. I've heard a lot of people tell me since we started doing this podcast that the best part of the podcast is just me ranting about things, just hearing me babble about different topics, because I've always been a good communicator. I've always enjoyed communicating, and I've always tried to find ways to put things into perspective and communicate it in a way in a way that kind of makes a certain topic interesting and engaging to you. I'm all about what's interesting, right? For you, the audience. I want to put things out there that is going to be interesting to the audience. And that's always what this show and this podcast will always be about. It's keeping your interest. It's educating you, number one, but a close number two is making it interesting. Educating you in a way that it is of interest to you, the audience. So, I think if we did do something like a co-host or something like that, it would probably be, a female co-host, maybe like a Howard Stern kind of dynamic, or, I don't know. There's a lot that, or, somebody that I have great chemistry with that, we can kind of bounce ideas back and forth on. But it might never be that. And I don't know if you as the audience even want to see that or not. Your feedback helps me a lot to kind of mold the show into what you want to see. Because folks, you drive this bus. You do. You drive the bus on this podcast. Whatever it is that you want to see is ultimately what we want to give you. And I think the content and the information we put out there is, second to none, to be honest with you. I don't think there's anybody that gives out more information than we do. We put out real quality, raw information about Medicare, but we also want to do it in a way that, it's informative, but it's interesting. It's fascinating. I think I'm an interesting person. I think I have a very interesting intellect to me in some things. I mean, sometimes I'm probably boring as a rock, but it's something that we want to make sure that we're communicating to you in a way that you enjoy, and we're just putting content down there that's fun to listen to, right? That's fun to listen to. So let me know what you think about that. I just wanted to start this segment off by just kind of giving you my thoughts and then sharing something that's kind of going on behind the scenes on the podcast. Let's talk about Minnesota Medigap plans, okay? So these are so weird. These are so strange on how these work. And I'm, like I said, in segment 1, I'm fascinated by this. So it looks like, for the most part, we're not given a situation where we have a Plan F, a Plan G, a Plan N available with any insurance company. It's just not something that's offered. See, Medicare supplement plans are regulated by their states. So clearly the state of Minnesota has their own rules and regulations on what's available to be offered. The plans are designed by Medicare, but the states determine what plans are able to be offered in that particular state, that state's insurance department. So we have a basic plan, and this is kind of what it looks like. Okay, this is on Medicare.gov. Okay, this is some from the horse's mouth directly. The basic plan covers Part A, skilled nursing facility coinsurance, provides 100 days of skilled nursing care. 80% of foreign travel, emergency only. 50% of outpatient mental health, Medicare-covered preventative services, 20% of physical therapy, state-mandated benefits, like diabetic equipment, supplies, routine cancer screenings, reconstructive surgery, and immunizations. The plan does not cover the Medicare Part A inpatient hospital deductible, which, depending on the year you're going to be listening to this on, could be anywhere between $1,300 to $1,400 right up front. So they don't cover that at all. They don't cover the Medicare Part B deductible, which in 2020 will be $198 one time a year. Usual and customary fees, which that could mean a lot of things. Coverage while in a foreign county. So that is what's known as the basic plan. And my first reaction to it is, coverage doesn't sound that good. Doesn't sound that good to me. The next plan on that they mention specifically is the extended basic plan, okay? So extended basic. The first plan was just basic, and this plan is the extended basic. So extended basic covers this. The Part A deductible, they do pay for that, thank God. Skilled nursing facility, 120 days in a skilled nursing facility, which is very interesting because Medicare on itself doesn't cover more than 100 days. So this plan looks like it adds an extra 20 days on top of the skilled nursing care. Don't see that every day. Part B deductible, 80% of foreign travel emergency, 50% of outpatient mental health, 80% of usual and customary fees, Medicare covered preventative care, 20% of physical therapy, 80% of coverage while in a foreign country. State mandated benefits, diabetic equipment, supplies, routine cancer screening, reconstructive surgery, and immunizations. Note, the extended basic plan pays 100% after you spend $1,000 in out-of-pocket costs for a year. So it has a maximum out-of-pocket. This is so strange because these two plans are not offered in anywhere but Minnesota. I mean, Massachusetts and Wisconsin might have something similar, and if I'm wrong and Massachusetts and Wisconsin have these exact plans, then I will stand corrected. These aren't my markets. I don't particularly know. I'm doing off of the research, okay? But these are different plans. These are their own things. They don't play by the same rules as any other Medicare supplement does, it appears. They stand on their own 2 feet. So people in Minnesota don't have the same choices as everybody else does. They have different plans available to them. Now, whether that's better or worse is up to you. The plans don't blow me away. Because if you have a $1,000 out-of-pocket maximum before you have full coverage on a Medicare supplement plan, I'm not blown away by that. Note, Minnesota versions of Medigap plans K, L, M, and N, and a high deductible plan F are available. I think I mentioned that the N wasn't there. I stand corrected. The N is there. Insurance companies can offer 4 additional riders that can be added to the basic plan, which basically every time you add a rider, it adds on additional premium. You may choose any or all of these riders to design a Medigap policy that meets your needs. Okay? So the riders that are available for the basic plan are Part A, inpatient hospital deductible, so you can pay extra and have that covered. Good. Part B deductible, good. Usual and customary fees, good. Non-Medicare preventative care, that's interesting because in regular states, they will only pay for something if Medicare covers it first, which means I've talked before about the Medicare limitations on preventative care. Typically, if Medicare doesn't cover something, I'll give you a physical for an example. Medicare doesn't cover a physical in the first 12 months. Medicare covers a physical in the first 12 months. After that, they don't. It's been a long day. Give me a break. Medicare covers a physical in your first 12 months on Medicare. They call it your Welcome to Medicare physical. After that point, they won't. They'll pay for a wellness visit. This is making it kind of seem like you can add a rider onto these supplement plans in Minnesota that covers non-Medicare preventative care, which probably would be a physical. That's unique. That's unique because you can't do that in any other state. There's no riders available to add on to Medicare supplement plans. There might be ancillary products, dental, vision, hearing plans, hospital indemnity plans, which I don't think you'd ever need with a Medicare supplement plan. But that is very unique, okay? You can add riders on and improve the coverage. So while the coverage doesn't look that great on its own, looks like you can add riders on and make them better and pay more for them. And kind of customize it to your needs. Very, very interesting. Because you're not going to see something like this in any other state. Now, will the other states kind of follow suit with this? I doubt it. I don't know. But it's interesting. So some of the traditional Medigaps are available. Like I mentioned, K, L, M, N. Those are still there. High deductible plan F. And we'll do an episode about high deductible plans at some point. But there's also these basic plans that kind of leave a lot to be desired, but you can add riders on, extended basic. You don't have a G or regular F or something like that there. Very unique, folks. And you have riders that actually you can add on to these supplement plans that cover things that Medicare doesn't even cover. Very, very, very unique. And if you're thinking about going to live in Minnesota, Massachusetts, or Wisconsin, you're going to have programs like this. It's not going to be to the same structure that we've talked about on this podcast. For the other 47 states, the Medigaps are what they are. Standardized, the same in all markets. But not in these places. This is a unique situation. These are individual plans. Very, very individual. And I'm just fascinated by it. I am. I'm a nerd when it comes to this stuff, folks. I am a total geek. And when I was doing the research, I just couldn't get enough. I just dived right in. And to my understanding, it's very interesting. Some final thoughts and some interesting things that you might want to know about Minnesota Medicare supplement plans. Don't go anywhere. If you know anything about if you know anybody, in Minnesota that's on Medicare, or if you live in Minnesota yourself, you're going to want to hear this information. I'll be back. Welcome back, everybody. Thanks for sticking with me on segment 3 of 3 on this special Minnesota Everything Medicare podcast. Go Vikes. I'm not a Vikings fan. For those of you football watchers, I just thought that'd be funny. I know that Minnesota residents and people from Minnesota are probably as passionate about their football team or their sports teams as you're ever going to find. That's what I do know from the people that I've known over the years from Minnesota. Friends I've had from Minnesota, passionate, crazy passionate, which I can get into. I'm a little crazy about things that I'm passionate about. So there's also some stuff I wanted to share with you. The basic and extended Medicare supplement plans are available to people in Minnesota when you enroll in Part B, regardless of your age or health problems. Okay, so a lot of there are some markets that don't allow you to pick up a Medicare supplement plan if you're under the age of 65 if you get on Medicare due to disability. Some states allow you to, but the premium is 10 times what it would be normally. It just depends. This looks like that's not the case from my understanding. This says you'll get another 6-month Medigap open enrollment period if both of these apply at the same time. You return to work, you drop your Part B to elected employer's health coverage. So let's say you turn 65, you're retired, you take A and B, you pick up a supplement plan, but then a year or two down the road you decide, I'm going to go back to work, I'm going to take their health plan. You drop your Medicare and you go back to work. Then you pick up their health plan. You're going to be able to return and pick up the Medicare supplement plans for extended and basic without any health questions down the road. So that's interesting. You'll get this open enrollment period after you retire from that employer plan when you elect for Part B once again. So Minnesota is kind of its own little world, it seems like. Like I said, if there's any Minnesota Medicare experts out there, you contact me. I want you on this show with me. Take me to class. Take me to school. I want to know everything. Very interesting, though. Very interesting. I'd like to kind of know the perspective of, because I'm sure there's people that work in the Minnesota market that work in other states as well. How does it compare to working in the other markets? What are the main differences you see? I mean, there's a lot of differences that we can tell, but this is fascinating. This is really interesting. Folks, as always, the open enrollment period rages on, but we're getting closer and closer to the end. I encourage you, if you live in the states of Utah, Texas, Florida, Idaho, Oregon, Utah, Texas, Idaho, Oregon, Florida. Did I say them all? Utah, Texas, Idaho, Oregon, and Florida. Those are our 5 states. where we can work with you if you have Medicare. We partner with all of the biggest insurance companies in those areas. We'd love the opportunity to be able to help you. It's not too late. December 7th is the cutoff date. Our office number is 801-255-5340, 801-255-5340. Thank you so much for listening, folks. Thank you for all of your support. Thank you for listening and being a great listener. I really appreciate you listening all the way to the end. And whatever platform you might be listening to us on, please give us a 5-star review if the platform allows it. If you're watching on YouTube, please subscribe for future content, like our video, drop a comment what you'd like to see in future videos. It helps us know kind of what you, the audience, want to see and hear. Until next time, hope you enjoyed this episode. I sure did. Have a great day. Talk with you soon.